think of data that is financial and clinical. Just to simplify it, the financial data is the claims data. So when you go to a doctor, they submit a claim. The clinical data is really the result of that. So when you look at a payer, like either it's a CMS or a private payer, they know that you had a chest x-ray, but they do not know the result of that chest x-ray, whether it's a pneumonia, whether it's a bronchitis, they just don't know. Those two sit in completely different silos. Now think of a large healthcare system that uses one provider of technology, an OS system, and they merged with another one, and that one uses another OS system. Those two systems do not talk to each other. So you have two layers of incompatibility. One of them is at the provider level, not all of the providers are interoperating with each other across the continuum of care. So hospitals, outpatient centers, surgical centers, and then you also have the financial data in the payers that are administrating this, not sharing the data and bringing it together. So if I had this kind of one wand, would be probably three things in a practical way. Number one, we've made a lot of movement, but continue to push regulation around interoperability across both financial and clinical, and make it just a state of affairs. And we have now the technology. So in the old days, you used to say, it would be very expensive for me to get another whole operating system. But now we have clouds, we have so many things that could interoperate. That's why I say AI right now is the perfect time, because cost is no longer a prohibitor. It's actually, you could begin to connect in the cloud and all of these things that you can do. So that's number one. Number two, we probably need to revisit some of the HIPAA laws. I think the last time we revisited them was 1996. And some of them, we've made some advances since then, and they're a bit antiquated, and we need to update them and move forward. The last thing is the public and private sector have to work together. It's a large industry. It's $3.5 trillion. It's going to become $6 trillion over the next 5 years. Think of an industry that would have 25% of waste. We have the technology right now to create interoperability, begin putting financial and clinical data. That will decrease the algorithmic bias. That will give us a great deal more of precision medicine, make sure that we just appropriately look at the HIPAA rules, and have public and private work together.